Hey, Aloha, I'm between calls right now. I just got off a call with one of my coaching clients and had a really interesting conversation that I thought you might find some value in. If you don't know me, I'm Dr. Russ Rosen, and I help natural healthcare providers thrive in a care versus scare true optimal health model. So here's the deal. I was having a conversation with this really great coaching client. He has been doing 3 month recommendations for a long period of time. He's now looking at possibly doing 1 year or 12-month recommendations. And there were some real concerns and fears that I hear these all the time. Now, I want to be very clear with you. I don't care what you recommend at all. 3 months, 1 year, 1 week, 12 years, doesn't matter to me. As long as it's what you feel is best for the patient, you feel that it's best for you as far as the kind of work that you do, et cetera. And as importantly, that you're not making larger recommendations because you're afraid of what they might think, or you're afraid of whatever else is a headspace issue, which we'll jump into, or procedural wise, you just don't know how to do it. So, to be clear, this discussion is not somebody who recommends 2 or 3 visits and is now looking at going to a year. That's a very different conversation. This one is he's been doing 3 month plans for years. Now, all of a sudden, he's looking at doing a 12-month plan, but there are concerns and fears that come up. So, the the information we're about to go through is really baked into our program. If you've already been through our communications program, this will all be a review for you. And if not, just know that these are all tiny little pieces along the way of what's built into our program. So the first, I asked, well, what are your greatest concerns? What are your fears? And the first one came up, and it was, well, what if I can't really deliver the goods? So what if I'm going to tell them what we're going to do over a 12-month period of time, but then that's not what they need, or I really can't deliver the goods? Okay. So my first question back is, well, what if you can't deliver the goods in 3 months? I mean, it's really the same thing, unless, of course, you didn't think the person needed a 12-month plan. But of course, we're assuming you felt the person needed a 12-month plan. So there are procedures that we use to handle that fear. So we start off in the consult, we let them know, I want to let you know my main goal is to make sure you're in the right place to get the care you need. My promise is I'm going to help. Either I'll be the right doc. If I feel I can help, I'll let you know. And if not, I'll do everything in my power to get someone who can help you, but I'm not going to waste your time. I'm not going to waste your money. So we're very clear up front that we're going to be honest with them. Then we're going to live up to that. In the report of findings, um, and the reevaluations, we are being very clear with them, the path to optimal health, when we are going through their care plan. We're going to recommend about this many visits over this period of time. And this is what you should expect subjectively. Like, here's how you should feel. And objectively, this is what we should notice. And then we'll do a re-eval and we'll do a re-report to make sure that you're really coming along as we would expect. And then we'll do this many visits over this period of time. And obviously, you're giving your best estimate. You don't know, because things could change. If they get hit by a truck, it's going to take more time, obviously. If they're not doing your recommendations, et cetera, they're not making lifestyle changes, or they're missing appointments. But in general, this many visits over this period of time, this is what you can expect, how you would feel, and what we would expect to see objectively. Then we'll do a re-eval, re-report. Then we'll do this many visits. Here's what you can expect subjectively, objectively, re-eval, re-report all the way through. So if you're doing that for a 3 month plan where you might get them to, or you're doing it for a year plan where you might get them to, it's exactly the same thing. So procedurally, you just need to know how to do those things, right? And that's just a little bit of that. But when you dive into the depth of that, then it's no difference between a 3 month plan and a 12-month plan. Okay, so the next issue that came up with, he was saying, well, that's a big chunk to ask for. It just doesn't feel comfortable. So in our process, we let them know that we give them options, right? So you can take it in stages. We find out here what level of help they truly want to get to. So we need to find out what they want in relationship to what we can truly do for them, and then show them how to have it. If they want to get towards optimal health, for most people, a 3 month plan simply is not going to be enough. So let's just assume someone did, and really you felt it was going to take a year's worth of care. Well, you can let them know you can take this in stages, or if you like, I can just show you how to get here. Which would you prefer? So it's really their choice. We're not trying to sell them something they don't want, right? We're not trying to make them do something they don't want. We're just being clear about what is it that you want. And then we ask them, how long do you think it'll take? Right? If they're not thinking it's going to take a year or two, they're thinking it's going to take a week or two. We have to handle that before we show them a year plan. But if you ask them, how long do you think it'll take? And they say, I think it'll take a couple of years, then why wouldn't you show them at least the first year of care, right? So that's kind of a procedural headspace issues. And yeah, the last piece of this is once you know how to do the things I was just talking about, like you've really studied it, you know, and it's working, you're going to see that the vast majority of the people are going to want what it is that you offer. In fact, if you're doing one-on-one coaching with me, my baseline is I want a minimum of 80% of the people of your new patients choosing your large care plan, whatever that is that you feel is best for that person. Again, obviously, if they had a hangnail, you wouldn't recommend a year plan, right? So it's just whatever you felt was true. Okay, so then what are the possible upsides? So I was asking this doctor, what are the possible upsides to offering the year of care? So obviously, you can get commitment from them, right? You can get the finances and the scheduling ahead of time so they can just focus on their health. So that's a real benefit to doing a larger care plan. We can be 100% honest with our patients about what it is that they are going to need, and they won't feel like they're getting strung along. So often we'll say something like a 3 month plan, then they get there. And even though you said after that, we'd probably need to do that, which most people don't do. They're so afraid to mention the 3 months that they just quietly mention the 3 months and they don't really mention what has to happen after. But if you did do that, they forget anyway, right? So it's they can often come in saying, "What do you mean I need to continue? I thought I was done." Right? So if you get all that out of the way up front, it's just a whole lot better. What are the possible downsides? So what are the possible downsides to offering an entire year of care? Well, the most common one is you blow them out of the water. They look at you like you're crazy. What are you talking about? A year of care? I have a hangnail. Well, you have to have done all the things you need to do in the consult, the exam, and the report of findings to be planting the seeds to get them to recognize the truth about where they're at and where they want to get to, how long it might take to get there, how motivated they are to get there, etc. So, the possible downsides, of course, is that you can blow them out of the water. Again, you can't have them think it's a hangnail. They have to understand the truth. They need to be clear about how long it would take. We need to make sure that they're really motivated to get there. And then we can offer it that they can take it in stages, right? So there's no downside to doing that. And the truth of the matter is the payment plans are much easier in a 12-month plan because they can amortize that over 12 months. So 3 months, each of those 3 months are going to be way more per month than it would be if I was amortizing it over time. So those are possible downsides, but that's what makes that work, or that's what makes that easier. Possible upsides to offering a smaller care plan, like a 3 month plan. It's easier for many people in their mind to say 3 months than 12 months. I understand that. There's less confrontational tolerance. But again, if you're doing it the way that I'm recommending, there's zero confrontational tolerance because you're asking them, where do you think you're at? Where do you want to get to? How long do you think it will take? It's much easier to give someone something they want than try to sell them something they don't want. Okay, so the confrontational tolerance should be zero if you're doing it correctly. Possible downsides to doing 3 months at a time or a smaller plan. Yes, less of these people are going to do the entire care plan. Even if you were honest with them, which again, most of you aren't, even if you were honest about after those 3 months, this is probably what we're going to need to do. The reality is they get there, they're feeling a whole lot better, and the urgency is gone. Okay. So then they don't get the care they need. They don't get to resolve the problems like they really wanted to. And it was all because you were afraid or didn't know how to simply tell them the truth. Again, does that mean that that can't work? No, not at all. You absolutely. I coach a lot of doctors that have, 80, 90, 100, above 100 PVA. They recommend the first month or 2 months or 3 months. It can be done, but you really need to do things right. Okay, well, what about the money? Well, as we had just talked about, look, will the total care plan be more expensive in a 12-month plan than a 3-month plan? Of course it will. But remember, if I can give them a bigger discount, if they're doing the year plan, I can amortize it over the period of time to make smaller payments. And the reality is they're going to spend less in the long run because what these people do is they do the 3 months, they get feeling better and they stop. So they crash again and then they come back and they go 2 or 3 months and they feel better and then they crash again. And eventually, oftentimes, they'll go past the point of no return where they now have damage that you're really not able to help them with, right? So would it be better for them if they could afford it to do the year plan? Absolutely. At least in my world, that would be true. And again, it needs to be true in your world. So the reality is they can get better results. We're going to find out what they want in relationship to what we can truly do for them and show them how to have it. If they do say that they want optimal health, then they're going to be able to get that, which is what they really hoped for. It's easier to finance. If it's not, so it comes up, he was talking to me about, well, what if it's not working? Well, what if I do a 12-month plan, but it doesn't work or it's not working? Well, it's the same thing as a 3-month plan, right? We're going to monitor them very closely. We're going to do this many visits with a reeval re-report. We're not going to do 3 months and say, sorry, it didn't work. We're not going to do 12 months and say, oh, drag, sorry, it didn't work. I have a 3-visit rule. If I see you come back with the same pattern 3 times in a row, I'm not talking symptom, I'm saying pattern of what I'm looking for, what I'm adjusting, we need to stop. Innate wisdom, when we're doing an adjustment, it's taking that adjustment and making appropriate changes. They're not going to come back with that same pattern over and over again, at least in my world. So if they're coming back with the same pattern, I let them know we're going to stop. Either you're going to do something different, eat better, exercise, deal with stress, come in more often, make your appointments. I'm going to do something different, right? A different technique, etc. We're going to do something different, or I got to refer you out because I'm not going to keep banging away on the same thing for an entire 3 month or a year period of time to find out that that didn't work. Okay, so then really nothing to worry about as far as that goes. No difference between the 3-month plan and the 12-month plan. And then also in my world, they're very clear about if it's not working and we will stop, figure out how many visits at the reduced rate, and then we'll give them the rest of the money back, or they maybe owe us some money, right? So those concerns and fears that come up usually are based on the reality is, I just don't know how to do this. Because in reality, for most patients, if we did the right things, they would want that. They would be happy to do that. It's what you would want if you went to see someone or if you brought your car in to get work done on your car. You'd really want to get the job done right versus some duct tape, which is going to cause you more problems down the road, right? So those are just some thoughts. I got a call coming up. I'm going to need to jump on. I hope you found value. If so, please share it with others. If you're interested in knowing more, feel free to jump onto our website, the ohcsystem.com, or set up a schedule a time for us to talk, and I can help you get clear about where you're at in your practice, where you'd like to get to, and how I might be able to help you get there. Hope that helps. As always, much love. Aloha.